Health literacy targeting kidney disease in an Aboriginal and Torres Strait Islander population in a remote area of South Australia. Group presentation for Aboriginal and Torres Strait Islander health. Annabelle, Sibel, Natalie, and Roshali.
Good morning class, I am Roshali and I will start this presentation off by introducing our group members. I'll be opening the presentation by discussing the links between Aboriginal and Torres Strait Islander culture and health. Annabelle and she will be presenting on the topic of Aboriginal and Torres Strait Islander social determinants of health, such as access to nutritious and healthy food, education and literacy, and health services and resources that contribute to impact of kidney disease. And lastly, Natala and Sibel will be discussing the contribution of culturally competent and safe nursing care in relation to remote Aboriginal and Torres Strait Islander citizens. Our healthcare context, health literacy, which is our healthcare need, and kidney disease, our healthcare issue as mentioned.
In this slide, I will be providing an overview of our healthcare topic. Section A. What is remote community? Remote Aboriginal communities vary in size according to the number of people comprising of that community. It can also be as small as a population as 100 people to a larger community comprising of more than 1,000 people. Amata is a community located in the remote regions of South Australia and has a population of 350 to 400 Indigenous people. Section B. What is health literacy? Health literacy is how a person can interpret, understand, and utilize information about healthcare. Low healthcare literacy has been linked to poor health outcomes. Therefore, it is an important factor when discussing culture and health. Section C. What is kidney disease? Kidney disease is loss of function or damage to one or both of the kidneys. Symptoms of kidney disease can go unnoticed. People with diabetes are at higher risk. Aboriginal and Torres Strait Islander people are 2 times more likely to experience kidney disease than non-Indigenous Australians. Aims and objectives. This presentation will identify the links between culture and Aboriginal and Torres Strait Islander health. Relevant Aboriginal and Torres Strait Islander social determinants of health related to kidney disease. Critically analyze considerations for culturally competent and safe nursing practice in relation to health literacy.
This video will highlight the issues in the Amata community of South Australia in relation to kidney disease.
All our families, old people, all our grandfathers and great-grandparents, they're only eating bush tuckers like emus, kangaroos, turkey, wild tomatoes, wild pigs. And they were healthy, no sickness. And then the white fella come into Australia. He bring all the sweet things like lollies, biscuit, everything.
With stores filling up with highly profitable sugary items and the community's health rapidly declining, John, his colleagues and a local health council established a program to ensure people had access to fresh, healthy produce. They called it Maywiru. The Maywiru quickly went to work. They removed deep fryers, added free cold water fountains, and hired a nutritionist to educate the community. For the children, they made music videos with psychedelic vegetables and put up these signs on the store's fridges. I put this one to the test, and I think they might be onto something. But most importantly, the local people were empowered and began making their own decisions about their health.
The community at Amata decided that they wanted to reduce the amount of sugar intake that they were having throughout the community.
The first high sugar item to go was the black fizzy stuff.
So they've said, we don't want Coke, so they don't have Coke. So no one is upset about it. It is a decision by the elders, and so we don't have Coke.
May Wiru was working, and in a very short time, Amata had the lowest rate of sugar consumption in the region.
With the level of sugar consumption in other communities I've been in, it's astronomical. It is over the top. I think the May Wiru group in itself could teach a lot of the other communities a lot.
But just when everything seemed to be headed in the right direction, the government slashed May Wiru's funding.
The organisation is now left with a skeleton of staff. The nutritionist was the first to go. The Pitjantjatjara Yangundara people really feel it because it was their idea. Like, they're the ones who saw the problem, they're the ones who bury their own people, they're the ones who want to make a change, and they've been totally ignored, overridden, and had funding taken off by federal and state governments and given to non-Aboriginal organisations. It's really quite outrageous.
The thing that struck me about Amata is that although Coke is gone, without a nutritionist to continue the education, people are still consuming vast amounts of sugar in other products. And their health is suffering as a consequence.
There's a perception abroad that the problems with obesity and diabetes may be related to alcohol, but here at Amata it's been a dry community ever since it was established. So all of the health problems, including diabetes and the kidney failure, is all related to the diet.
John offered to take me to a special place where the full effects of a disabled May Wiru can be felt.
I've known almost everyone buried here. I've got family members buried here. These 5 graves here are all people under 40. That's another young person in there. Whole group up here of 2 sisters and a brother who all passed away from kidney failure. Most of these deaths here are premature and could have been avoided with correct diet and access to affordable, healthy food.
Links between culture and Aboriginal and Torres Strait Islander health. Aboriginal health means not just the physical well-being of a person, but also the social, emotional, and cultural well-being of the whole community. It has been evident that Aboriginal people are suffering from kidney diseases due to many historical, psychosocial, socio-economic factors. There are many more factors affecting Aboriginal and Torres Strait Islander health, such as living conditions, inadequate environmental conditions, and poverty. Aboriginal and Torres Strait Islander people are almost 4 times more likely to die due to chronic kidney disease as compared to non-Indigenous people. From the statistics, it can be reviewed that in 2012 to 2013, every 1 in 5 Aboriginal and Torres Strait Islander people who are above 18 had been suffering from chronic kidney disease. Historical and economic content. The kidney health of Aboriginal and Torres Strait Islander people has been greatly affected by the changes in their lifestyle due to colonization of European settlers. The decreased level of physical activity, along with the poor nutritional diet that resulted from displacement by the Europeans, have become social foundation for a decline in Aboriginal and Torres Strait Islander health. The other modifiable risk factor influencing their health includes diet, obesity, and many Aboriginal Torres Strait Islander people lack medical care, which affects the health to great extent. And behavioral and biomedical risk factors. The factors responsible for the kidney disease among the Aboriginal people are combination of multiple risk factors, including repeated infections, high blood pressure, obesity, low birth weight, infant malnutrition, and other behavioral risk factors include poor diet, low physical activity, alcohol, and tobacco. Mayviru Sugar Challenge Foundation, as seen in the video, the European settlers introduced foreign grass to which the Aboriginal communities couldn't grow native food on the land. Therefore, the Aboriginal and Torres Strait Islander people transferred their diet to European diet which contains a higher sugar content. Link between culture and health literacy. The Mayor Viru Sugar Challenge Foundation provides the Amata community with nutritionists in the stores to educate the community about how to incorporate the health literacy in Aboriginal and Torres Strait Islander culture. This would help them to make better health-wise decisions and to enhance the link between culture and health literacy, workshops and seminars should be held to help the Aboriginal and Torres Strait Islander people to make better informed health decisions. So, in the end, we can conclude the culture plays an important role in affecting the Aboriginal and Torres Strait Islander health. These factors include historical, socio-economic, behavioral, and modifiable risk factors affecting health literacy.
The social determinants of health. What are the social determinants of health? The social determinants of health are factors that correlate with one another to influence an individual's health and well-being. The social determinants of health that impact on kidney disease in remote Aboriginal and Torres Strait Islander communities include access to nutritious and healthy food, education and literacy, and health services and resources. Access to healthy and nutritious food is a social determinant that has a tremendous impact on the health and well-being of Aboriginal and Torres Strait Islander people living in the remote community of Amata, South Australia. Complications and disease arising from poor diet has been identified as the main cause of illness and early death of people living in this community. Due to the introduction of processed and high sugar foods, kidney disease has been the result and noted as one of the top 10 causes of death among Aboriginal and Torres Strait Islander people. Eating a nutritious diet in a remote area is difficult, as food travels a long way and a variety of fresh produce is not always available. Due to the lack of nutrient-rich food, processed and packaged food is relied upon as the main source of nutrition. Before the colonization of European settlers, Aboriginal and Torres Strait Islander people had an active lifestyle and lived off the land. The displacement of communities and introduction of processed sugar alongside the gradual decline in activity has resulted in the decline of kidney health among Aboriginal and Torres Strait Islander people. Education and literacy is a social determinant that impacts greatly on the health and well-being of Aboriginal and Torres Strait Islander people diagnosed with kidney disease in the remote community of Amata, South Australia. Education and literacy in relation to health is the ability to make informed decisions about personal health care. Opportunity through education provides the skills necessary to achieve better health outcomes for individuals and communities. In the community of Amata, education about health has declined, which has had a negative impact on the health and well-being of Aboriginal and Torres Strait Islander people in the community. Many individuals are experiencing chronic kidney disease or end-stage kidney disease as a result of diabetes. Life-sustaining dialysis is required to keep many people alive. The local health council in Amata established a program known as Mayviru to make sure the community had access to healthy food. The local people were empowered with knowledge to make decisions about their own health. The program was successful, but due to cuts in government funding, the community lost local nutritionists and healthcare workers, which caused the health of Aboriginal and Torres Strait Islander people to once again decline. Health services and resources are a social determinant that are a vital aspect in maintaining the health and well-being of individuals and communities. Barriers to accessing adequate healthcare services and resources include cost, language and literacy, age, gender, education about available resources, remote location, lack of transport, and a lack of understanding about disease. In recent years, there have been significant improvements to healthcare services in remote communities, with the relaunch of the May Wuru Sugar Challenge Foundation. The foundation is raising funds to send 10 respected Aboriginal and Torres Strait Islander elder women to a retreat to learn about the benefits of healthy eating. On return to their communities, the women will be able to provide life-transforming knowledge to help their families and friends be better equipped to make better informed health choices. In conclusion, access to nutritious and healthy food, education and literacy, and healthcare services and resources are the social determinants of health that impact on the health and well-being of Aboriginal and Torres Strait Islander people diagnosed with kidney disease in remote Australia.
Demonstrating culturally competent and safe nursing practice to support health literacy for Aboriginal and Torres Strait Islander people living with kidney disease in remote South Australia. What is cultural competence? Cultural competence is a set of consistent behaviour, policies and attitudes that connect the system amongst a multidisciplinary team that follows effective work in differing cultural situations. What is health literacy? The Australian Commission on Safety and Quality Healthcare 2018 defines that health literacy is how an individual understands, interprets, and utilizes information about healthcare. How to demonstrate culturally competent and safe nursing practice. Effective communication and working in partnerships are vital contributors when incorporating health literacy into culturally competent and safe nursing care to Aboriginal and Torres Strait Islander people living with kidney disease in remote Australia. Communication enables honest, trustworthy and compassionate relationships amongst Aboriginal and Torres Strait Islander patients and family members, allows for understanding of health literacy issues in order to promote adequate care to Aboriginal and Torres Strait Islander people. Advocate health by participating and promoting health services such as health literacy, disease and screenings in communities, as well as meeting cultural obligations with honest respect and sensitivity regarding prevention. Acknowledge the importance and role that family and community of Aboriginal and Torres Strait Islander peoples play in healthcare related decision making within healthcare services, partnerships and collaborations, and providing prevention strategies and care delivery. Factors: skills and knowledge. Understanding that social and emotional well-being is very important to Aboriginal and Torres Strait Islander people. Bring an elder, friends or family to support the patient. Working with Aboriginal and Torres Strait Islander people can provide nurses with new knowledge. Consultations and partnerships are important as they can reduce the chance of offence, misunderstanding and stress of Aboriginal and Torres Strait Islander patients. Effective communication to prevent misunderstandings. Bring an appropriate Aboriginal and Torres Strait Islander interpreter if available. Nurses may choose to participate in Aboriginal health education workshops to enhance cultural awareness. Read articles or do research to enhance their knowledge about Aboriginal and Indigenous communities. Nutritionalists incorporating traditional Aboriginal and Torres Strait Islander diet into modern lifestyle, such as bush tucker and cooking books. The May Wuru Sugar Challenge Foundation employ and train nutrition advisors to work in-store to empower the Amata community. Nurses can educate and empower the community of Amata by taking on more community-based work. Demonstrating culturally competent and safe nursing practice to support health literacy for Aboriginal and Torres Strait Islander people living with kidney disease in remote South Australia continued. Factor: patient-centred care. Act as an advocate through knowing your Aboriginal and Torres Strait Islander patient and their cultural beliefs. Communicate with patient and immediate family to create clarity and meet both health and cultural needs. Provide an interpreter for greater clarity. Attempt to communicate through simple photo card explanations. Advocacy. Participation in efforts to promote health in the Amata community. Educating influential members of the community about healthy living to further spread that knowledge onto others. Contribute towards programs that help inform about health literacy and education. Some communities have developed partnerships with healthcare professionals, combining traditional and Western modern medicine to provide satisfactory care and encourage Aboriginal and Torres Strait Islander people to utilise healthcare services. Family and community can have an influence on decisions, so be open-minded. Without cultural competence, traditional landowners may become reluctant to utilise healthcare services, resulting in an increase to failed attendance, lack of confidence in healthcare providers, and overall mass communication. In conclusion, health literacy is made up of effective communication and working in consultation and partnerships, which are significant in demonstrating culturally competent and safe care in nursing in relation to providing person-centered care, addressing health literacy issues, and improving on knowledge and skills to support Aboriginal and Torres Strait Islander people living with kidney disease in remote Australia.
In conclusion, links between culture, social determinants of health, and demonstrating cultural competence and safe nursing practice are all vital in meeting health literacy needs of Aboriginal and Torres Strait Islander people living with kidney disease in remote Australia. A prevalent contributor to improving Aboriginal and Torres Strait Islander health is for nurses to create clarity when communicating healthcare needs by understanding health literacy issues, understanding needs of the community, and empower influential members of the community to promote education in children. The May Rear Sugar Foundation has allowed improvements to health literacy issues of the Amata community through programs such as educational retreats for community members to learn in a safe and culturally competent environment. The future goals of the May Rear Sugar Foundation promote employing nutritional advisors for in-store to promote fresh alternatives and minimize sugar intake to reduce kidney disease. Therefore, by tackling and addressing social determinants of health and cultural needs, nurses and healthcare professionals can create better health outcomes in a culturally competent and safe manner.
What we now know that will transform our nursing and midwifery practice for improved Aboriginal and Torres Strait Islander health in the future. We now know that health literacy is a tremendous issue for Aboriginal and Torres Strait Islander people living with kidney disease in remote communities in Australia. This is due to a shortage in funding, lack of involvement from government agencies due to accessibility, lack of empowerment from the community due to health literacy issues. Health needs to be interpreted to Aboriginal and Torres Strait Islander members in a way they can connect to for greater impact. Changes to traditional Aboriginal lifestyle resulted in a decline in cultural practices and led to adopting European lifestyle, which involved processed foods as a primary nutrition source. Accessibility to fresh food is scarce due to factors like distance and travel time. Community members are more willing to learn when traditional culture is incorporated into educational practices.